Over the past 10 years, evidence has grown to suggest that the extent and severity of periodontal disease, put simply gum disease, may be associated with an increased risk of coronary heart disease. In particular, there has been 50+ studies which have investigated whether the extent and severity of periodontal disease puts patients at a greater risk of atherosclerotic vascular disease. This disease is where plaque, known as atheromatous plaque, which is made up of fat, cholesterol, calcium and other substances found in the blood, hardens and narrows your arteries over time, limiting the flow of oxygen-rich blood to our organs and other parts of our bodies. A study reviewing data from 100,000 patients, for instance, found that prevalence and incidence of coronary heart disease are significantly increased in patients with periodontal disease. One notion is that the bacteria in periodontal disease stimulates the immune system and produces inflammation. This means that regions of the blood vessels that might already be developing plaque due to cholesterol are stimulated further to form a blockage. A second notion is that periodontal disease bacteria get into the bloodstream, become incorporated into the atheromatous plaque, and exacerbate inflammation. What a lot of research work is revealing to date is how important it is to keep your mouth healthy through regular brushing and flossing to keep bacteria in check. A large Scottish study has shown that participants who brushed their teeth less often had a 70% increased risk of a cardiovascular disease event. We would hypothesize that neglecting your dental health and allowing bacteria to build up could increase the chances of these kinds of bacteria getting into the bloodstream. Getting data to support this is difficult, as it would not be ethical to set up a long-term study of people with poor dental hygiene without attempting to improve it. There are also multiple risk factors for heart disease, including smoking, alcohol consumption and diet, and all of these would be likely to impact on the data. But there are many researchers, like myself, who are very intent on providing sufficient evidence to get inflammation included as a recognized risk factor for cardiovascular disease.